Hello and welcome to Experts on Demand. This course is called Marketing in O&P, applying mainstream marketing trends to our corner of healthcare. In this course, you will learn how social media is being harnessed today by individuals seeking healthcare solutions that seem out of reach. Through best practices and relevant case studies, this course highlights social media marketing opportunities specifically through the lens of O&P, so you can create deeper connections with your patients and community. After completing this training, you will be able to identify and share relevant user-generated content, name the social channel businesses should focus on, identify tactics to create a successful post with viral results, manage your online community efficiently, state social platforms that can help businesses find content and potential patients, and learn about protecting your business through the social media releases. To receive 1.25 ABC CEUs, please complete the quiz for this course. Enjoy!
My name is Melissa Langley. I'm the manager of the Marketing Strategy and Brand Communications team at Ottobock. And I've had about 6 years experience in marketing communications, and I actually started as the social media specialist here at Ottobock. So I do have some experience in the topics that we're going to cover today. And make sure if you have questions, you can input those into the chat, and we'll go ahead and answer those at the end. Let's get started. At Ottobock, we always start our presentations with reminding us why we do what we do, and social media is a big part of this. We help people maintain or regain their freedom of movement. And just to cover what our agenda will go over today, first we're going to start with understanding the why. Why is social media so important, especially for O&P clinics, for connecting patients and establishing communities? Next, we're going to go into the best places to get social. So really exploring some of the social media channels that you probably already know, but why it might be critical for you to, as a maybe clinic owner or someone who is practicing in a clinic, to really get your presence on these channels as well. Finally, we're going to go over some tips and tricks how to accelerate your social media engagement, and we'll discuss ways that you can go viral and how to identify which posts might go viral with a little extra support. And then finally, we'll wrap up because all of these things, it's great to understand the why and know where social channels are and understand how to make a post go viral. But if you don't have your office set up for success, then all of these things can't really accelerate. So we'll walk through practical ways to set up your O&P office to make sure that your social media programs are running smoothly. Okay, so our first slide here is establishing your community. And really your patients are your resource. And we like to say that, you know, the conversations that patients are having are already taking place online. You know, right now we're living in a digital world, and being digital has allowed people to connect with each other as a daily part of their life. And so it's no different when it comes to healthcare. Really, social media communities of support are places that patients are turning for information and peer-to-peer support for each other. So when patients are going online, they're not only discussing their personal experiences, but they're also asking each other, you know, for advice on how to talk to their practitioners. And there are these certain individuals who we'll call patient influencers who are really leading healthcare communities, and they play a crucial role in the actions that patients choose to take on their healthcare journey. So just to give you a quote here, folks are seeking advice, and they know who they can rely on, who they count on, and they know that they're getting accurate information from them. They generally seek those individuals to help frame questions, and once they're armed with the questions, they have more confidence to go discuss things with their practitioners. Another quote for you, online communities are resources for patients or caretakers to get feedback from people who may be going through similar experiences or may have been on a specific healthcare path for a longer period of time and can elaborate on potential side effects and or costs. So what this means is that your social channel can establish your practice as a credible resource. So we know patient conversations are taking place online. So if you're not where your patients are, then you might be missing an opportunity to connect with them. 60% of patients say that they visited a Facebook page before making a purchasing decision, or maybe even booking an appointment. And so practices that maybe are staying on the sideline, as we said, are not only missing out on potential new patients, but if your practice isn't available where your patients are, such as social media, you run the risk of seeming old or outdated. So in that case, you might consider that if you're not having a social media presence, that your patients might be more inclined to go to a competitor. And finally, we'll talk about word of mouth recommendations. These are much more reliable than opinions posted online. Actually, word of mouth is something that we all know. When someone that we genuinely admire their opinion and we respect them and we trust them and they give us a recommendation for something, just in casual conversation, we're much more likely to move forward with that recommendation than if we saw maybe an opinion that was posted online by a stranger or someone that we didn't necessarily feel exactly connected with. So the same is true for healthcare. So it's true that online communities are extremely important when it comes to sharing healthcare information, and 91% of individuals say that online communities do play an important role. And we say that when someone is presented with information that is given to them by that credible word-of-mouth reference, 93 of those individuals will directly ask their physician about the information that was presented to them, and they will make a recommendation. 94% of them will further that word-of-mouth message and with people that they might deem are interested. We go to our next slide here. This is a good way to talk about how really this is working. This individual is you, your patient clinic, and then you potentially tell an individual about a new product or resource. And this person is a trusted and credible source to the communities that you're trying to reach. They share that information with their friends. Then those individuals will share that information with their friends, and so on. And this is how information is spread digitally, and posts can go viral, and your clinic might be all a part of this. So next we'll talk about how do you empower your patients to share a message. And really it's just to understand that influencer marketing really does work. So far we've talked about word of mouth, which is the conversations that are taking place either online, could be through private chats or in a community group page. An influencer is someone who, this is more of a technical definition. Influencer marketing is really when a brand works with an online influencer to share its product or services. But the key for us in healthcare is that influencers don't have to have 1 million followers. We've all heard these days about Instagram influencers. So you might be wondering why this might apply to your practice or to your patients. But in our business, what we have seen is that we are working with individuals that we would call micro niche influencers. So these are individuals who have maybe less than 1,000 followers. But what we've seen is the less the number of followers a person has, the greater the influence of their word of mouth recommendation. This is because influencer marketing is not about the amount of followers, but the quality of those followers. As we've established, our patient communities are already developing online, which means that your patients are likely to have other individuals with similar medical conditions as their followers, or just as their friends. So when we're trying to understand why influencer marketing may work for us, what we're really saying is that we have to empower our patients to share our messages that we want them to and that they feel comfortable with. And in that way, it can start a cascading event that shares a message way beyond what we could just potentially reach with sharing our own messages. So how do you find your influencers? So this is important too. We have to connect with a patient who would be the best to share our word of mouth marketing. And this really means that as we, and we'll go into where we want to place our social channels and where we would like to place our messaging, really all about social media is the point in the fact that as a clinic, if you're going online, you really do have to get social. It's an interesting way to discover more about the patients that you are serving and then to outreach and see where they're building their communities. You can easily discover the chattiest patients online by following them and then engaging. You can find these individuals by seeing who is sharing the posts and the content that you're putting online. And engaging with a comment, with a like, engaging with a post is a term that we use often to describe when someone is liking or commenting on a social media post. So you can find individuals as well who may be repeat commenters or repeat likers. These individuals might be your influencers. When you find them, my recommendation to you would be to follow them on their social channels and then engage with them there. When you are engaging with a like or a comment yourself, this is also providing more visibility to your clinic, in a way inviting other potential patients to follow you. Okay, so let's go ahead and take a look at the best places to get social. Firstly, we know Facebook. This is really the home base for your O&P clinics. The reason why is because we've noticed that 80% of participants who are participating in studies say that they share their health information via Facebook posts. These could be private within community groups, and 81% of those participants also said that they share their health information via Facebook messages. So a lot of this is happening behind the scenes, so private health care information isn't visible publicly, but it's absolutely certain that these types of conversations are taking place on Facebook rather than Instagram, because Facebook happens to be a place where you can share a lot more in terms of links, videos, photos, and you're not limited by character count. So you can really craft a very long message on Facebook if you wanted to. Also, Facebook is going to be the first place that your patients or potential patients will look for your practice online. When they do find and discover your Facebook page, it's a great way to show the successes of your patients and to tell more of your patient stories, and in that sense, show what you are doing and what you're committed to doing. On top of this, Facebook is the best place and probably where most people will go to look for important updates during the pandemic, when everyone is really curious about what are the protocols? Are you open? How do I make an appointment? Timely updates on Facebook are going to be the place that they go first to find that information. Another caveat just to remember about when you do create your social media presence is that you are establishing yourself now as someone who is responsive and can be reached on social media. And in fact, people request appointment or follow-up discussions via social media, and they are expecting responses within a few hours. And on top of this, social media posts, especially on Facebook and activity, by doctors is trusted over any other group. 60% of social media users respect and value the opinions of doctors over any other source on social. So with this type of engagement online, you're establishing an inherent degree of trust. which is something that you can utilize for further patient engagement. And to give you another insight about where you might spend a lot of time on developing your Facebook page, really take a look at your About section. So we have a couple of places here. First, there is your mission statement and About. This lets your patients and potential patients know more about you and the why for what you do. Make sure you're filling this out clearly and succinctly. Make sure you add your important contact information, your website, your telephone number. And then finally, if you are interested in engaging with the community even more, community groups can be a great way to take patients who might be communicating on their own, on their personal channels, and bring them into a fold that you have visibility to and can stay in contact with more easily. Moving over to Instagram, I would highly recommend that if you have the bandwidth and the time, to also create an Instagram channel. This will be your entertainment center. This really does establish your brand culture. It's a place where you can have fun and keep those users engaged in a more constant stream rather than just by posts that you may be publishing once every few days. It also helps you showcase your best work, and really Instagram is the best community building platform. And in this platform, video content is really king. So Instagram now has been more focusing on something that's called Instagram Reels, which are longer form video content. Could be about, maybe 2 to 30 minutes. It's really up to you how long, but you now can upload longer form video content onto this particular channel. And what this means for you is that you could potentially be filming a patient's first steps with their permission, and if they're comfortable sharing that to this channel, which showcases the great work that you're doing and definitely shows patient successes. In between posts, because we're not posting every day on this channel, we maybe will post twice a week or 3 times a week, depending on how much time we have. You can keep followers engaged by posting to Instagram stories. And Instagram stories are something that disappear after 24 hours, and they have a variety of different formats. So stories can be interactive. They have the possibility of utilizing polls. They have Q&A questions. They also have multiple choice questions. So if you use a certain strategy with these stories and you have a good enough following, you might even be able to get some more content out of those Instagram stories, some suggestions for what other posts that you might be able to make. Now, TikTok, you've probably heard of. This is something that I wouldn't recommend that you put your particular clinic on unless you have a dedicated content creator, someone who is dedicated to creating this content and putting it on TikTok. The reason why I'm suggesting to look into it is because you might discover content that you can share back to your Instagram or back to Facebook because this area has a majority younger users, but what I've been seeing lately on TikTok is there's also people who are in their late 30s, early 40s who are using TikTok as well, especially people who are in communities such as those that we work with. Because again, communities are taking place online. Individuals are going to social media to engage with those communities. And again, as I mentioned, TikTok videos can be shared to Instagram, which is a great way if you're looking at, trying to find longer form video content, but you don't know necessarily how to create it on your own, or you don't have the time to create it on your own. If a patient of yours, let's say, has a TikTok account, I definitely recommend following them and asking them if you can share those videos to your Instagram. And again, TikTok is just a great place to get ideas, how to make a video that goes viral, a new way maybe to film something that might be a little bit more engaging and make your particular clinic stand out. So again, TikTok, not necessarily a place where you need to put your practice online, but a good place to investigate if your patients are on there and see what they're doing and get ideas and maybe content to share. So now that we have established why we should be on social media, and we've established where on social media we should be, now we want to accelerate this engagement. And again, an engagement is a like, a comment, or a share. Those are the things that we're talking about. That's what makes a post go viral. You absolutely, within your patient clinics and in your O&P community, have all of the tools that it takes to make a social media post go viral. In fact, what we've seen at Ottobock is that low quality video content is king. You really can't beat those real life experiences that you are seeing day in, day out at the practice. So my recommendation would be showcasing your best patient fitting if the patient is willing to be recorded, and we'll talk about that a little more in our next section. But honestly, just someone walking with a knee for the first time or trying out a new foot, and then maybe just telling a bit about the experience and what they're feeling, or why they love the product that they're on. These are the things that other patients are going to connect with, and it's going to make your content shine on social. We also, when we're trying to find a post that's doing really well, we like to look at the engagement. Again, I mentioned it's a like, a comment, or a share. And when we see that a post is maybe getting a little bit more than what we normally do, so especially those comments, if you see, maybe you're getting one comment here and there, sometimes people won't comment at all, but if you do see a little bit more engagement, like maybe 3 or 4 comments, this is your clue that this post has the potential to get more eyes and exposure on it than potentially without extra support. So if you do have the ability within your budget to support your social media posts, you can use the Boost Post button, which will be under each of your posts on Facebook, to help with some paid advertising to just give this a little extra view to the individuals in your community. So when you do click this button, the posts will be more visible to the individuals who like your page already. And I would only recommend doing this if you see that there has been greater amount of engagement on this post. And for that, sometimes it could be as little as $5 to get it really, a little bit more viewership out there. And I've seen some individuals do like $20 for a particular post. So it's really up to you and what you have in terms of budget for this, but it does help to get more exposure for a specific post. And why we might want to get more exposure for a specific post is because we want to invite people to share that post so that we can find new individuals to connect with us, because it's not staying insular within the individuals who do just like our page. Once something is being shared regularly, they're going to share it outside of their communities to new people, and that's how you're going to attract more likes to your page. How do we set up the O&P office for social success? I think this is really critical because sometimes, we're talking about social channels, we're talking about things that seem like, okay, yeah, I can do that. But if you really go back to understanding, what is the reason why we're doing this? And if this is to drive more patient engagement, maybe potentially about new patients, we do have to make social media a priority. This is no longer something within businesses that we can say, oh, this is just something we do on the side. we actually do need to commit to social media in order to make it a success. And the reason for this is that there are different pieces of the social media program that you might run that do need dedicated support. So for this is community management, which we'll talk about in a minute, the content creation, so actually making the videos or making the image posts that will be shared online. Next is the social media execution, so someone who is scheduling the posts, making sure that they are getting pushed out onto the channels at the right time. And then that influencer discovery. Who are your patients that you are currently working with that really have, you know, that spark in the community to make the messages go far? Looking for them is a part of social media success, and it does take dedicated time. Community management. This helps to establish credibility, and when we talk about community management, what we mean is the comments that you might be getting on a social media post. These are comments that do require some form of communication back from you. And in order to make sure that those are being responded to in a timely way, you might consider utilizing a community management tool. The three that I'm showing here on this slide are free to a certain level. If you add more users or more channels, then you might have to pay additional fees for these. But what it does is it takes all of the comments that you're getting and queues them up for you in a way that's easy to access and read and see. Rather than going back natively to the Facebook platform and checking and make sure you haven't missed anything, these community management tools will make sure that you don't. What these community management tools also do is pull in direct messages, so private messages that are being sent to your Facebook or Instagram account, which just makes it a little bit easier if, let's say, you have one dedicated person who is posting for social media. They also have the ability to go outside of the platform to view those particular questions and get help if they need it. Sometimes answering questions natively in the platform, so within Instagram itself, can be a little bit tricky and difficult. But if you have all the questions right in front of you within a community management tool, it can be very helpful. Again, we talked about content creation, and here we're going to talk about one of the most important ones that we've found at Ottobock. It's called user-generated content. User-generated content simply means it is content that patients have created and posted themselves to their personal channels. We also call this UGC, just for shorthand. When we're following our patients online and we see a great post that they've done, we want to ask them, is this something that we can share? And then that way, that is what helps establish credibility within our channels, because we're actually showcasing great patient content from our own patients. It really just does speak to an individual who comes to your page and they're seeing that it's a real life story. They're connecting with those individuals who, you know, really don't have a reason to potentially share something that isn't real. Excuse me. They see this as a trustworthy and reliable resource. Okay, next is your posting cadence. And again, just remember that as patients are online building their own communities, we need to go to where those patients are. And we really need to see our practice or our brand as a community member. When we do this, we need to understand who our audience is. So think about your patients and when are they most likely online? This could be before or after work, maybe during lunch, maybe while they're waiting for an appointment. So it's crucial to understand, and you can actually, if you use a community management tool, you can see when your posts will be the most successful. And how you do this is by automating your posts. So initially, you might have a good understanding of when you should post online, maybe, let's say, 5 p.m. So when someone's getting off of work and they look at your post, you're assuming that it'll be 5 p.m. So we automate the posts to go live, which can also be done through a community management tool at 5 p.m. If we do this for a little while, we start seeing like, you know, when I'm posting at 5, I'm not getting as much engagement as I like. So you test that and maybe you move it to 3 p.m. And then you can compare the two to see which one is getting more engagement and then make an educated choice to start posting more regularly at 3 p.m. versus 5 p.m. Also, when you're in your community, the best thing you can do is learn from your patients, copy what they do, and then repeat that. There's no shame here in social media. Trends are something that people hop on board along, and they, you know, everyone has seen some memes that have been repeated in different ways. You take your own spin on something that is being shared within the community. So if you can, and you see what your patients are talking about, what's getting the most engagement on posts that they're sharing, why not take that, copy it, turn it into something of your own, and then release that through your social channels as well. So really, when you're talking about posting cadence, again, it's not a great idea to start these channels without the dedicated support that you need. One of the things that turns people away from engaging with a practice online, and what does make people find your practice less trustworthy, is when they go to your Facebook page or your Instagram channel and they see that you haven't posted in a year. This is something that lets them know, tells them that you're not actively engaged online and that you're not actually a part of the community. So it's very important to make sure that you're keeping yourself visible by at least being active on that page once or twice a week, so that your patients can know that this is something that is updated. It's not, you know, an abandoned page. And refresh your logos or Facebook headers and your About section when necessary, so that, you know, if you've made updates, you would like to show them that. Finally, I think one of the most important pieces of this is that you do want to protect your practice. And really what this is about, it goes back to Ottobock's mission of we help people maintain or regain their freedom of movement. We want to share their stories with compassion. So right now within the social media sphere, the way that we do that is we would ask permission, especially when it's a social post that someone else has posted. We would just ask them, hey, we love this. Is this something that you would allow us to share on our social channels? We do that publicly so that individuals know that we've asked and it can be seen by the public. And then we would share this onto our channels without fear that anyone is worried that we've taken something without permission. Especially when sharing user-generated content as well, because this is something that people have developed themselves, probably feel very proud of. Next, a really important thing is signing a media release. And a media release is a document that legally protects you from any issues with sharing content that you have filmed of another individual. So for example, if you're in your clinic and you have a patient who's doing a first fitting and you really feel like this is going to be great content for social media online, make sure you ask their permission, let them know that you would like to film this, that it would be released, where it would be released. So if it's on social media, your website, let them know and ask them if they would be comfortable with that. And just to firmly establish that this agreement has been made, have them sign a media release. In this way, you're safe when you're sharing that. If someone is upset, you know, maybe after the fact, you can point to this and let them know, so sorry, you know, we did sign this to ensure that you're comfortable. And when you do have cases with individuals who maybe feel uncomfortable with social posts, you can always delete these. So that's also a great way to maintain your relationships with individuals online, just share stories with compassion and help individuals if they're feeling uncomfortable, even if they had said yes previously, to remove those. When you are signing a media release, it's pretty uncommon for that to happen because there is an agreement already in place. That pretty much wraps up what we wanted to talk about today. I just wanted to offer you a few social tags here. Please follow Ottobock on social media. You can find our Instagram, Facebook, our global TikTok, and LinkedIn accounts. And then finally, our resources from today's presentation. You can take a look through those. And thank you so much for your attention. I really appreciated your time and signing up to hear from the Ottobock marketing team today.